comes to mind when you hear rheumatoid arthritis? Most of the time we think of inflammation of the joints in our wrists, elbows, and feet. However, patients diagnosed with rheumatoid arthritis can also have what is referred to as extra-articular manifestations, symptoms and conditions that are not necessarily related to the joints. Extra-articular effects occur in about 40% of patients with rheumatoid arthritis and are more common in patients with long-standing active disease. Therefore, these symptoms can indicate severity of the condition. Skin nodules are some of the most common extra-articular manifestations and are most often seen on the back of patients' hands and elbows. Skin nodules are actually an important marker of disease severity because the presence of these nodules can lead to other problems like ulcerations or lesions of the skin and eventually gangrene if it goes untreated. Nodules can also be seen elsewhere in the body, not visible on the skin surface. Patients with these skin nodules are more likely to have something called pulmonary nodules or nodules within the lungs. These can only be seen with a chest X-ray. Unfortunately, these are often asymptomatic but have the potential to become cancerous and must be monitored very closely if they're found. Other lung conditions can be common in patients with rheumatoid arthritis. However, like the lung nodules, are usually asymptomatic and not always picked up on examination. Pleural diseases, such as pleural effusion, have been detected in 50% of rheumatoid arthritis patients on autopsy. But only a dismal 10% of these cases were actually detected and diagnosed by a physician. Now, since rheumatoid arthritis is an autoimmune disease, this autoimmunity can be carried over to other organ systems. In about 6% of rheumatoid arthritis patients, autodestruction of salivary glands has been reported. This usually presents itself as the patients having swollen salivary glands and a dry mouth. Autodestruction of the lacrimal glands has also been found in rheumatoid arthritis patients. In this case, the patient will complain of having severe dry eyes. This can eventually lead to a condition called keratoconjunctivitis sicca, which is basically an inflammation of the cornea and the inside of the eyelids that's usually caused by dry eyes. If this is left untreated, it can lead to further eye complications. Rheumatoid arthritis patients also seem to be more prone to cardiac complications. It's quite common to see patients with cardiovascular disease risk factors like high cholesterol. Pericarditis, which is inflammation of the sac that surrounds the heart, is the most common cardiac manifestation. Again, like the lung conditions, pericarditis is typically asymptomatic and only usually revealed during the patient's autopsy. Myocardial infarctions are also more prevalent in patients with rheumatoid arthritis, specifically in women. Women with rheumatoid arthritis have double the chance of having a myocardial infarction compared to women without rheumatoid arthritis. In women who have had rheumatoid arthritis for 10 years or more, this risk is actually tripled compared to other women. The final major extra-articular manifestation is anemia, which is one of the greatest, if not the most, commonly clinically detected of all the previous ones I just mentioned. Patients can present with anemia at any time during the course of the disease. In the case of rheumatoid arthritis, anemia is actually directly correlated with the degree of joint inflammation and can also indicate the amount of damage done to the joints. Although traditionally we think of rheumatoid arthritis as a disease of the joints, we must consider other extra-articular effects of the disease as well. These are not only predictors of disease severity, but must also be addressed to improve patient outcomes.